together with my colleagues. Good morning. I'm also going to be very brief because my colleagues have already said what I was supposed to say. But in addition to what my colleagues have said, we want to say that the negotiation which has been going on between the government and these unions have simply collapsed. I want to note that the government on the table has only been frustrating our efforts to have an amicable solution to the issues we addressed. Even the little that the government had given to health workers, we are being told that the Ministry of Public Service and Human Resource Development has not developed a code to enable the frontline health service package allowance to be paid. So, trade unionism, when we started our engagement with the government, we never said that the little that has been given to us should not be paid. Because the policy in trade unionism is that get the little they have given you and then fight for more. There has been nobody amongst us that has told the government not to pay that little money that it has given us. So we have no reason. The government has not told us why that money has not been paid. We are aware that some counties have paid using other methods because there is no cooperation from national government in terms of facilitation of payment of that money. We have also been informed reliably that the Ministry of Health and those charged with managing COVID fund that is being put together by government and other stakeholders, including WHO, World Bank, and other fellows. You heard in the airport, they stole the assorted PPEs that had been contributed by Chapmo and the other guy from China. They stole it. And the stealing happened with fellows in the Ministry of Health and those at the airport. I don't mince my words. Because when you steal those PPEs, you cause the death of our colleagues. You cause the death of Kenyans. And that is why we have lost 2 of our members. We will not sit back and watch some criminals sitting somewhere in Afi House scavenging on the money that is meant to protect this country from COVID-19. We are aware that they are advising the president not to reopen the economy. And the reason why they are advising the president not to reopen the economy, they want to continue looting. Because I have evidence that the Ministry of Health and those charged with the responsibility of managing COVID-19 funds are spending 1 billion per day. They have so far spent close to 100 billion. Billions, not millions. Yes. Billions, not millions. That's why they are taking tea in Afi House that is coming with a rocket from heaven. Their tea is cooked in heaven. That's why the tea can go to 4 million per day. I'm telling the president, this is public funds. The issue of transferring criminals who have stolen public funds meant for fighting COVID-19 should not happen. I want to urge the Cabinet Secretary for Health, Mutahi Kagwe, if you are not taking action, if you are not sending these criminals home who have stolen this money, you must resign. You must resign. You cannot preside over impunity. Ministry of Health has stolen from the dying. It has stolen from the dead. And yet, you are transferring these very criminals. So we are saying we are going to issue a fresh strike notice reawakening the one that we had suspended. And in the next few days, before close of business today, government will receive communication from us that we are going on strike. We no longer want to go for those miracle meetings in the Ministry of Labor. and social protection that are not yielding anything. We want the president to directly be in charge of the Ministry of Health and crack the whip. These fellows stole 5.4 billion, which was meant for mothers, which was meant for people with HIV/AIDS. And nothing happened. The only thing the government did was to transfer some fellows. These fellows stole 320 million for immunization. The only thing the government did was to transfer some fellows. These fellows spent 1 billion on containers that should have spent 14 million. The only thing the government did was to transfer some fellows. Those containers are still lying in Mombasa. A container that was supposed to cost 1.4 million in market rates, Kenyans were buying for 10 million for one container. And that's our money. It's your money. It's public funds. When journalists in a national media group investigated the 5.4 billion heist, they threatened to kill her. I told them, kill her if you are men enough. And I mentioned the people who are behind that stealing. The government transfers those fellows, which means Afya House is a cow cash for big boys and girls of this nation. Because you cannot be transferring people. Fighting corruption cannot be selective. Waluke nao amefungwa na wale wameiba mabilioni Kenya hii hawajafungwa. Fighting corruption must not be selective. We want to see health rolling in Afya House. And I'm challenging the minister, the CS for health, if you can't have these people arrested and sent home, resign. Mambo ya Kiingereza mingi kwa TV hatutaki. Na watu wanaiba pesa ya wagonjwa, watu wanaiba pesa ya watoto, wanaiba pesa ya wamama, wanaiba pesa ya wagonjwa, wanaiba pesa ya watu wa ukimwi. Alafu mnawahamisha. Kwa nini mnawahamisha? Ikiwa nyinyi wenyewe si wafisadi? Kwa sababu mnaokopa wakifanywa uchunguzi hata nyinyi mmekula hizo hela. President, fungua inji. Hakuna any evidence that so far we have that says that Tanzania is worse than Kenya. We have many Kenyans working in Tanzania. Yesterday I was meeting some of them. There is nothing in Tanzania, life is normal. Kwa hivyo mambo ya kufunga Kenya ndio wakora waendelee kuiba pesa wakikula, hiyo tumekataa. Rais wale wanakuambia funga Kenya, hao ndio wezi. Kwa sababu wakifungua Kenya, wanajua pesa ya msaada haitaingia. Na kwa hivyo watakuwa hawataendelea kuiba. Kenyans, we are very dishonorable people. We steal even from the dead. We steal from the children. We steal from the pregnant mothers. We steal from HIV patients. What nation is this? Naambia rais, wakati ni sasa, na kama sio sasa, ni sasa hivi. Mheshimiwa Raila Odinga, hiyo handshake tunataka kuona Afya House ikisafishwa. Tunataka handshake ya kusafisha ufisadi. Hatutaki handshake ya kusafisha ufisadi kwa mapendeleo. Kwa hiyo mimi nasema kwamba kama viongozi wa katika nchi hii tumechoka na mambo ya watu wako kwa serikali, badala ya kulinda maisha ya Wakenya wanatumia nafasi hiyo kujinufaisha na kujitajirisha. Na wale ambao wanahusika kuwapa adhabu wanawapatia mahamisho, waende kufanya mahali pengine, waendelee na ufisadi mahali pengine. Enough is enough, Mr. President. Take charge of the Ministry of Health. Send these criminals at home. Na waende chela, wakae kamiti. Asanteni, kama mna maswali mseme. Yes, sir.
They just wanted to know, you talked of 100
billion. As things stand today, we have group accident benefit arrangement which is under the Work Injury Benefit Act. And that one will be used to calculate what is due to those who have died because of COVID-19. That is if they are working within the public sector. In terms of saying where and where we cannot, because the statistics that we are getting from the Ministry of Health is not giving us where these people are. But what we know, we have over 100 health workers affected or infected by the infection, and 2 of our colleagues have so far lost the battle. Now they have gone even without getting this COVID frontline package. While some fellows are using 1 billion in half house party, I don't know what they're using that money for. Now hakuna hata gloves.
Yeah, so maybe to also add to that is that the 2 colleagues, one is from Nairobi and the other one is from Kajiado. But we will not give further.
Okay?
You are proposing the reopening of the economy.
Yes.
Yet, as at 2030,
Yes.
the Council of Governors said that out of 47 counties, you only have 12 countries, not I think 12 countries that are already making a recommendation that you let's have 300 bed capacities. Do you think that's not ridiculous? Or
What scientific evidence do you have to say that we have been having restrictions, we are doing better than Tanzania that has never had restrictions? Are you having any journalists who have lost jobs? Or it's only us who are losing jobs? Those workers are losing jobs in private institutions. All employment has reduced by 50% in this country. We cannot afford to continue closing and locking down the economy of this country. I am telling you, if you want to have a civil uprising in Kenya, lock this country for another 6 months. We will have a civil uprising. There is no way you can close all bars in Kenya. Wanafikiri wao wanafanya kwa bao, wanakula nini sahi? Alafu niliona rafiki yangu ako kazi alipata msaada ya shilingi 2,000 kupitia kwa simu. So people even who are getting that money are not even the ones who are affected. I've seen a friend who was sent 2,000. Wewe unapewa 2,000 utakula siku ngapi na watoto? How many days will you pay rent with 2,000? Let us face reality, bwana. Open up this country, let Kenyans live. The only thing we are opposed to is opening of schools. Secondary and primary schools should not open. But colleges and the rest can open. Those are adults. People who can take care of their own life. Lakini maneno ya kufunga uchumi sahi ndio wakora wengine waendelee kujitajirisha. You will not accept.
Yeah, let me add to that. So what we are saying, as we are providing a strategy for the government to be able to reopen. And we must say this, if we are going to close the country beyond 3 months, then somebody will question whether as a country we know what we are doing. Why do you close a country? You close so that you can understand the outbreak and take the measures so that by the time you are opening, you can be able to manage. And I think that is what the president put in place the last time he met the governors and made some directives. But further, we are telling them, as we reopen the economy, which we agree should be reopened, because we are having so many unintended effects. You have seen the teenage pregnancies, the homicide, the suicide, the crime rates, and the list is endless. So as we reopen, how do we protect our members? How do we protect our fellow countrymen? And that is where we are saying, number one, we are saying because we have a vulnerable population, it will be foolhardy for us to tell them to go to the hospital. Because outside there will be a surge in transmissions, and if you expose them to going to hospital, then you mean you want these people to die. So what we are advising is that the government, the same way the president gave a directive to police and to teachers so that they can reach the ratio to wananchi, to give a directive so that we can have 10,000 more health workers employed, and these health workers can be able to go to where the patients are. Waende nyumbani kwenye wagonjwa wako, wawatibie huko. And this is what happens in China. That is what we are proposing. So that is the strategy we are giving the government. Reopen the economy, protect the vulnerable. How do you protect them? Employ more health workers, let the vulnerable stay at home, and let the health workers go and treat them there at home. Number 2, conduct vaccination campaigns to ensure you reach every child in their home. Number 3, avail medication for those living with health conditions and diseases for free in all facilities and ensure the medication is taken to their home. And we are trying to collaborate with any technology that may be there to be able to collaborate this to ensure that we can be able to see the patients wherever they are, and very soon we'll come and tell you what we are going to do about this. Thank you. Any other question? So COVID-19 allowance, because it has not been paid, we are saying it must be paid. For the past 3 months, they must pay with the July salary. If it's not paid, we will be back here to tell you the steps that we'll be taking. Number 2, Corona is not ending in June, because the COVID allowance was for 3 months up to June. So we are requesting, we are demanding that this allowance, because it's supposed to cushion health workers and motivate them as they protect the country, it will be extended until Corona is over, and after that it's harmonized and retained as health risk allowance. Thank you. You can take the question. Hamaritwa makwa njĩtagwo Peterson wa Wachira, ndĩ mũikarĩri gĩtĩ wa kĩama gĩa ũteti gĩa Kenya Union of Clinical Officers. Na mũthĩ tũkĩte haha twĩta atongoria a ciama cia ũteti arĩa marũgamĩrĩire aruti a wĩra a Ministry ya Health, nĩgetha tũhote gũkorwo tũkĩarĩrĩria maũndũ matiganĩte nĩ ũndũ wa ũgima wa bũrũri witũ. Tũrarĩrĩria maũndũ matatũ mũthĩ, na nĩ kũhingũra economy, ũhoro wa gũkorwo tũkĩtigĩrĩra andũ arĩa tũrauga nĩ vulnerable kana andũ arĩa mangĩhotwo nĩ mũrimũ ũyũ nĩ mararorwo, na wagatatũ nĩ atĩ aruti a wĩra a afya makorwo makĩrorwo wega. Maũndũ marĩa tũrendekithia nĩ atĩ harĩ kũhingũra economy, ũndũ wa mbere tũrauga hatirĩ na ihenya rĩa kũhingũra cukuru. Ciana cia cukuru he corona mahana mosquito, mekũgĩa corona ndũkamenya, na nĩo marĩcambazaga na nĩ aingĩ mũno, ũguo megũtũma yambate na ihenya mũno. Namo makanitha nĩ tũrauga hatirĩ na ihenya rĩa kũhingũra kanitha, nĩ tondũ nĩ twĩ ndũngĩhota gũcontrol makanitha na tũgũkorwo tũkĩongerera transmission rate tũtũme ĩkorwo ĩgĩthiĩ igũrũ mũno, na tũgĩkorwo tũkĩrigĩrĩria andũ aitũ arĩa me vulnerable nĩgetha matigakorwo magĩkua. Nĩ tũrauga atĩ thirikari itũ ĩtigĩrĩre atĩ nĩ yaruta ndawa cia bũrĩ citarĩ na marĩhi kũrĩ mũndũ wothe ũraikara na mũrimũ, na tũrauga andũ aya matikerwo mathiĩ thibitarĩ, andũ aya maikare harĩa marĩ, gũkorwo gũkĩandĩkwo aruti a wĩra a afya aiganu matwarĩre mathiĩ kũmathondekera mĩciĩ kũrĩa marĩ. No ũyũ ti ũndũ atĩ tũrauga twanjĩrĩrie haha Kenya, ũũ nĩguo gũtũire gwĩkĩkaga Cuba ĩrĩa tũrauga nĩ tũkoretwo tũkĩrora na tũkĩenda gũkorwo na health system ĩhana ta ya Cuba. Tũngĩhota gwĩka maũndũ macio nĩ tũgũkorwo tũkĩrigĩrĩria andũ aitũ. Na wagatatũ nĩ atĩ harĩ allowance yaheirwo nĩ mũnene wa bũrũri harĩ andũ arĩa mararuta wĩra wa afya nĩ ũndũ wa wĩra ũrĩa mũritũ mararuta na matikoretwo makĩrĩhwo. Nĩ tũrauga makorwo makĩrĩhwo harĩ mĩeri 3 mĩhetũku ĩkorwo ĩkĩrĩhwo na mweri ũyũ wa mũgwanja, na kwaga ũguo nĩ tũgũkorwo tũgĩcoka haha tuge nĩ makinya marĩkũ tũkuoya twĩta ciama cia ũteti, na tũgacoka tũkauga atĩ allowance ĩyo yendereithio nginya rĩrĩa corona ĩgakorwo ĩgĩthira, na yarĩkia ũguo ĩcoke ĩikare ĩta health risk allowance, nĩ tondũ aingĩ matirĩ na arĩa angĩ thĩ mũno. Harĩ andũ aitũ erĩ makoretwo magĩkua nĩ ũndũ wa mũrimũ ũyũ, na nĩ ũndũ wĩna kĩeha mũno, nĩ tondũ ũyũ ti mũndũ wakorirwo nĩ mũrimũ harĩa arĩ, nĩ mũndũ wakorirwo nĩ mũrimũ akĩgeria kũrigĩrĩria wa Kenya matigakorwo makĩrwara na akĩgeria gũthondeka arĩa angĩ. No thĩna nĩ atĩ thirikari ndĩkĩrĩte life insurance na compensation marĩhi harĩ andũ aya nĩgetha gũtigĩrĩra me protected, family ciao cigũikara atĩa mũndũ ũcio akua. Na tũrauga ũũ nĩ tondũ kũngĩenderea ũũ na makorwo gũtirĩ na life insurance, aingĩ nĩ gwĩtigĩra megwĩtigĩra, matigwĩtĩkĩra gũthondekana tondũ nĩ maramenya makua megũtiga andũ ao na thĩna. Thank you mũno.
nimepeana nani? Sio tunaenda kwa wengine.
Ata? Uhoro wa itanda ri kuu nĩ kuga already ithuĩ nĩ tũrĩkĩtie horo na tũkauga nĩ twĩtĩkĩrĩte andũ aitũ makorwo makĩrwara rĩu tũramarorera thibitarĩ kũrĩa megũthiĩ no ithuĩ tũroria tũngĩmarigĩrĩria atĩa matikahũthĩre itanda ici na nĩkĩo tũrauga andĩka andũ aiganu andũ aya mũndũ ũyũ rĩrĩa arauma nyũmba arathiĩ thibitarĩ nĩ kũmũ expose ũramũ expose ya infection nĩgetha kũrigĩrĩria ndakagĩe infection rĩ nĩ ikare mũciĩ tũma ndagĩtarĩ athiĩ mũciĩ amuonere kũu arĩa rĩu megũkorwo makĩrwara nĩ anini mũno na itanda iria twĩ nacio nĩ igũkorwo ikĩruta wĩra. Thank you.